Good afternoon, everyone. I would like to welcome all of you, all our attendees who have joined us this afternoon. We will be starting in a couple of minutes. For those of you who are not able to join us on Zoom, we are live on YouTube as well. So you can go on the link on YouTube. Just give us a couple of minutes and then we can start our breast cancer awareness session.
I can't hear.
Are you able to hear me? Yes. All right. Good afternoon, ladies and gentlemen. Thank you for taking out time of your busy schedules to join us today on this lovely Sunday afternoon. It is my pleasure to welcome you all to our breast cancer awareness webinar in collaboration with Al Hilal Hospital and Medical Centers. Allow me to introduce myself. My name is Madonna. I am the training coordinator at the 9 Training Center. And it is my pleasure to be moderating this breast cancer awareness webinar for today. Before I begin, I would like to inform all our attendees that after each session, which will be given by our speakers today, Dr. Hafiz and Dr. Divya, we will be having a question answer round, as you can see in the next slide. We have 3 ways in which you can ask your questions. The first will be the verbal questions. You will be able to view a raise hand icon, just like this, as you can see on the screen. Your questions will be answered after each session. The second one is the written box where you can post your questions and it will be answered by the respective doctor. And the third is where you can interact directly with our speakers. Uh, this would be on a more personal level for those of you who would be not able to pose your question in public. All right, so without much further ado, I would like to request our Managing Director, Ms. Gopika. She is our Managing Director of the 9 Training Center, to give us a few words before we go ahead with this webinar. Ms. Gopika?
Thank you, Madonna. Salam alaikum and good afternoon to everyone. Your Excellencies, distinguished guests, ladies and gentlemen, it is our great honor to welcome you to this highly beneficial breast cancer awareness webinar this afternoon. We thank our extremely valued client for several years, the Al Hilal Healthcare and Medical Group, and especially their CEO, Dr. Sharath, for their immense ongoing support and cooperation. The color pink reflects mixed emotions, lives lost, lives changed in dramatic ways, and also every speck of pink represents hope and victory. I believe that everyone should raise awareness about this disease, and hopefully we will find a cure for this very soon, inshallah. Now, I would like to also welcome Dr. Ansari and Dr. Divya from the Al Hilal group, and I will hand over to Madonna to take this event forward. Millions of thanks, everyone, for joining in today. Thank you very much. Madonna, if you could take this event forward, please.
Thank you, Ms. Gopika. And yes, definitely, it would be a pleasure to go ahead and hear from our expert doctors. So I would like to introduce to you all our first speaker for today, Dr. Hafiz Ansari. He has been with Al Hilal for a couple of years, and he has 8 years of experience as a general consultant and as a laparoscopic surgeon as well. So, Dr. Hafiz, all the best, and I would like to allow you to share your screen so you can go ahead with your talk and your presentation.
Thank you very much, Madonna. Shall I start now?
Yes, you may go ahead.
Yeah. Good afternoon, everyone. As you all know, this October month every year is Think Big. That means we need to raise awareness about breast cancer. So why is it important that a full month, a whole month is dedicated for creating the awareness about breast cancer? Why is it so? And we will have a bird's eye view of breast cancer, why we have to be aware about this, and how we are going to do it. So let's start. So why is it important to have awareness about breast cancer? Because it's the most frequent cancer among women, and it causes the greatest number of cancer-related deaths among women. And 15% of all cancer deaths among women are caused by breast cancer. And earlier it used to be a disease of the developed world, but not anymore. Now the incidence is increasing all over the world. So how to improve breast cancer outcomes and survival? The only way is early detection. As in any other cancer, if you diagnose the disease early, the outcomes will be much better. the cure rate as well as the survival rate will be much better. Most of the cancers are staged into four: stage 1, 2, 3, and 4. Stage 1 will being the earliest stage, and 4 is the advanced stage. So usually, if the disease is detected at stage 1 and the treatment initiated, then the outcome will be much better when compared to a disease detected at stage 4. So that's why early detection is very important. So what are the strategies? So how do we detect the disease early? There are two strategies. One is early diagnosis and the second is screening. Early diagnosis means uh, we are trying to diagnose the disease at an early stage itself, either stage 1 or stage 2. And screening means before the patient has any symptoms, we are trying to diagnose the problem. So the goal of early diagnosis is to increase the proportion of breast cancers identified at an early stage. So this allows for more effective treatment, and it reduces the risk of death from breast cancer. As I told earlier, if a disease is detected in first or second stage, the outcome is much better, as well as the quality of life also will be much better when compared to a disease detected at an advanced stage. And the early diagnosis is especially relevant in settings where the resources are less. I will come to that point later. And what do you mean by screening? Screening means testing women to identify cancer before any symptoms appear. So the patient will not have any symptoms at all, but we are testing beforehand to know if there is an early disease so that the treatment can be initiated as early as possible. So how do you screen? The methods of screening are mammography, ultrasonography, MRI, and in some cases, clinical breast examination. The imaging modalities will be discussed by Dr. Divya Lakshmi in the next session. So I'll just have a word about clinical breast examination. It's examination of both breasts performed by a trained health professional. It's a promising approach for low resource settings, but this is inferior to mammography. So, should I undergo screening, and if yes, when? The answer to the first question is every woman should undergo screening for breast cancer. And when, to answer when, you should know whether you fall into an average risk group or high risk group for developing carcinoma of the breast. So, who are individuals at high risk for breast cancer? Those who have a family history of breast cancer on advanced age, that is, the older you get, the chances for getting breast cancer increases. Suspicious reports in previous breast biopsies. For example, previously you had a lump in your breast which was removed, and the report has said that it's a suspicious of cancer, but needs follow-up like that. If that is the case, then you are at high risk for breast cancer. Then the next is personal history of early breast cancer. That is especially if at an age less than 40 years. So if you are 50 and you had a breast cancer before the age of 40, that means and the treatment has been completed, still you are still liable to have a breast cancer again, either in the same breast or in the opposite side. Another cause is ionizing radiation exposure before the age of 30. For some diseases like lymphoma, it needs radiation as part of treatment. So if you are exposed to that at an age less than 30 years, then there is a chance that your risk for breast cancer is high when compared to an average individual. And I mentioned family history of breast cancer. So what do you really mean by a family history of breast cancer? It's one or more relatives with breast or ovarian cancer as well. So not necessarily breast cancer. If you have a family history of ovarian cancer, that also raises your risk level. And again, breast cancer occurring in an affected relative younger than 50 years. If you have an affected relative who is younger than 50 years, then your chance is high. Male relatives with breast cancer, BRCA1 and BRCA2 mutations. These are some genetic mutations which will be carried over uh, in generations. And if you have these mutations, then your chance of breast cancer is high. Something called ataxia telangiectasia heterozygotes. It increases 4 times the risk. And some people of Jewish descent, Ashkenazi Jewish descent, 2 times the risk. And it's independent of BRCA positivity. So the next question comes, when to start screening? So the average risk individuals, it should start from age of 45. Annual mammography from age 45, and ultrasound may be added to improve the yield. There is no role for MRI unless in doubtful cases, and there is absolutely no role for clinical breast examination for screening in case of average risk individuals. Most important is MRI, and ultrasound may be added to that. No, most important is mammography. Sorry, ultrasound may be added to that, and MRI is used only if there are doubtful cases. In high risk individuals, annual MRI screening starting at least from age 30, combined with mammography. That is the at least from age 30, you should start screening. That is the current recommendation. In some cases, even if it is started from an earlier age, it's fine. There is no need for breast cancer screening in women aged more than 69 years. Now coming to signs and symptoms of breast cancer, either there can be no symptoms at all, especially in early breast cancer, or there could be a lump in the breast, which could be associated with the change in breast size or shape, skin changes, nipple abnormalities. Either the nipple can protrude out or it can retract in. Nipple discharge, especially if it is blood stained, and an axillary lump. If you see a lump in the axilla, then it can be, not necessarily, but it can be a symptom of breast cancer. So how do you diagnose? What we say is a triple diagnosis. Triple diagnosis means you need clinical examination, that is the examination by your doctor. You need to image the breast, that is either by mammography, ultrasound, MRI. And third is you need a tissue diagnosis, that is either by needle biopsy or core biopsy usually. And in doubtful cases, you might even need an excision biopsy, that is you excise the lump and send it for testing. And then depending on the report, then we will start the treatment. So what are the treatment options? The treatment options, conventionally, 3 treatment options were there: surgery, chemotherapy, and radiation. And the science has progressed now. So immunotherapy and hormone therapy also has been added, which has greatly improved the outcome of breast cancer. And the treatment strategy of each patient will be customized, because no 2 patients will be the same. So it will be decided based on the stage of the disease, how early you have diagnosed, the general condition of the patient, the age of the patient, is the patient has any other comorbidities, whether the patient, what is the life expectancy of the patient, what's the hormone receptor status of the patient, and etc. So a few words about clinical breast examination. No clear benefit of regular physical breast examinations done either by a health professional, that means clinical breast examination, or self breast examination in average risk individuals. but the women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away. So what is the relevance of CBE and SBE in individuals who are at high risk of breast cancer and in populations where screening programs are inadequate, in populations where an annual mammography might not be possible for some, either due to cost constraints or something. So in those populations, the screening programs are inadequate. So a CBE and a self-breast examination will be beneficial because it doesn't cost anything. So, so a few words about self-examination. How often do you need to do? You need to do it monthly. When do you have to do it? You don't need to examine your breast every day. You need to do it only on a monthly basis. So when? The best time is 3 to 5 days after your period starts. And it's especially important that you have to do it at the same time every month. Because in 3 to 5 days after your periods, your breasts are not as tender or lumpy. So if at all there are any other lumps, abnormal lumps, it is easy to palpate. And if you have gone through menopause, do your exam on the same day of every month. Maybe first of every month or the last day of every month, first of every month, like that. So how to do a breast exam, self-exam? There are 5 steps. Step one is you should stand in front of a mirror and begin by looking at your breast in the mirror and with your shoulders straight and your arms on your hips. So what all do you need to see? Whether the breasts are their usual size, shape, and color, whether the breasts are evenly shaped without visible distortion or swelling. If you see any of the following changes, you need to see your doctor. If there is any dimpling, puckering, or bulging of the skin, a nipple that has changed position, or an inverted nipple, if there is any redness, soreness, rash, or a visible lump, then you need to see your doctor. Now, coming to step two, you need to raise your hands and look for the same changes. Again, these same changes, like this dimpling of the skin, nipple changes, or there is any redness or something like that. And coming to step three, while you are at the mirror, look for any signs of fluid coming out of any of the breast, any of the nipples. The nipple discharge could be watery, milky, or yellow, or it can even be blood. If there is any discharge, any sort of discharge, you need to consult your doctor. Now coming to step four, now you need to lie down and examine your breast. You need to use your right hand to feel your left breast and left hand to feel your right breast. And cover the entire breast area and use the middle of the fingers and not the tips, because your tips are very sensitive. Even if normal nodularities, you may feel as a mass. So you need to use the middle of the fingers. And finally, you feel your breast while you're standing or sitting, and perform the same routine as in step four. You cover the entire area and use the middle of the fingers. Thank you so much for the patient hearing. All the best. Thank you.
Thank you so much, Dr. Hafiz. If you would just allow me to share my screen.
Yeah, please.
Thank you so much once again, Dr. Hafiz, for giving us a very insightful, like different types of methods to do the breast exam. Um, we haven't received any questions from our audience, so I would like to ask one question. Uh, what would be like the side effects for each um, the treatments that you mentioned, the mammogram and the MRI? What would be like the best? Okay, I believe we have Lost. Dr. Hafiz.
Doctor, I think she's calling you.
Okay. Anyways, I believe we'll just go ahead with our next speaker. Um, question and answers will be answered after the session gets, before we end the session. We'll have around 5 to 10 minutes for question and answers. I would just like to introduce our second speaker for today.
I can't hear. Just a minute.
Dr. Divya, are you with us?
Okay.
Yes, great. All right, so let me just introduce our second speaker for today, Dr. Divya. She is a radiologist at Al Hilal, and she has
Hello.
completed around 5 years with Al Hilal. So I would just allow her to give us her expertise about mammography and X-rays, and she would know best. So over to you, Dr. Divya. You may now share your screen with your presentation.
Okay.
Yes.
Good afternoon, everyone. I hope everyone is enjoying with the session. I'm Dr. Divya, working as a specialist radiologist at Al Hilal Medical Center, Manama. So I'll be talking to you regarding the imaging aspect of breast lesions. So without wasting much time, I'll be starting my slides. Okay. So what are the different
Doctor, you need to close this system.
just a minute, there's some disturbance. Okay. So I'll be talking to you regarding the imaging aspect of the breast. So for screening, as Dr. Hafiz told us, there are different imaging modalities, the most important being the mammogram. And additionally, we have ultrasound. And for few instances, we also use MRI breast for screening purpose also. So the other imaging modalities like CT, bone scans or other interventions are basically used for advanced diseases, mainly to diagnose any spread of the lesions. So I'll be discussing today mainly regarding the mammogram, ultrasound, and the breast MRI. So most of us will be thinking, why should I need a screening even though I don't have any symptoms? Does it really matter? Yes, of course, because less than 1% of the lesions have pain, and those lesions with less than 1% have cancers. So pain is a very different aspect here when it comes to cancer, because 99% of the lesions are painless. So our role here is to detect those lesions which are painless, and before it becomes visible, we have to diagnose it as early as possible. So the breast lesions can be either visible or it can be invisible. So how does it matter? Like if it is invisible, then it will be the treatment aspect changes. It will be just removing part of the breast and giving radiotherapy. But once the lesion becomes very big and once it is visible, if you are able to palpate the lesion, most of the lesions will be in stage 3. That needs a different treatment, like entire breast will be removed and additional chemotherapy will be given. So it's always better to diagnose these invisible tumors before it's too late, because the 5-year survival for these tumors, which are very small, is very good. the outcome of this treatment is very good, and it's almost 95%, the 5-year survival of for these patients. So I'll just have a word what happens on the day of screening. So you all know that mammogram is the most important and most commonly used for screening purpose. Along with that, we also have ultrasound added to mammogram in some cases for further characterizing the lesion. So mammogram is basically for those who are more than 40 years of age, and ultrasound we do it for a little younger people, like less than 30, who are basically in their reproductive age group. And additionally, with mammogram also we do ultrasound. So once you take an appointment for a mammogram, what happens on the day of mammogram? So here I am showing a schematic representation of how a mammogram is done. You can see the patient stands in front of the machine and the breast is placed on the plate, and with additional paddle it is pressed, and X-ray tube, which is seen on the top, sends the rays and the breast is imaged on the plate and we can see it in the monitor. So this is a real mammogram machine, how it looks. So we take 2 X-rays for each breast. So there are many of you must be scared of taking a mammogram, because there are common myths which people believe that mammograms are only for those who feel a lump. That's a false thing, because mammogram are basically to diagnose those small things which are invisible. And some people are also scared that breast will be radiated and they may get cancer from the X-rays. So I'll be discussing this, how much radiation we give to the breast, in the next slide. And few of you may think that already they got a mammogram, so there's no need for another. So that's also false. It doesn't mean that the next year you'll be not getting any lesions or anything. So some people think that it's already detected something, so it's too late. That's false, because we are trying to detect those small things which are not visible clinically. And a few also believe that it's only for those with a family history. So just to tell you that 25% of the breast cancers have positive family history. So the rest 80% or 70 to 80%, they don't have a family history. So we have to bring awareness to everyone to get the mammogram and get the lesions, or if any abnormalities are there, to get it diagnosed as early as possible. So as I told you that breast will be radiated. So how much is it radiated? It's very minimal. It's just 0.4 millisieverts. Millisieverts is the unit which we use for measuring how much we radiate. So just to compare, a normal person in Europe gets a background radiation. It may be from surrounding uh, television, the mobiles or electronic devices, everything. That the normal person, which he gets a background radiation, is 2.2 millisieverts per year. And how much are we radiating for an X-ray mammogram is just zero point 0.4 millisieverts. So it's very minimal. It's a very low dose radiation which is given. So benefits are more compared to the risk factors in mammogram. So we have to know that the benefits outweigh the risks of X-rays. So how does a mammogram look? This is a normal mammogram image of the right breast. So as I told, we take 2 views, one from top to bottom and one from the sides. So both the breasts will be imaged like this. And this is how it looks. This is a normal mammogram, how it looks. So coming to ultrasound, as I told, ultrasound is done basically for a younger population who are in the reproductive age group, less than 30s, or even we can do up to less than 40s also we do it. There's no radiation because ultrasound is basically the sound waves. We give a high frequency sound waves through the machine and we read the images. It is painless. There is no compression of the breast tissue here. As in mammogram, where the breast is pressed between the 2 paddles, there is no compression of breast tissue in ultrasound. It is non-invasive. There is no invasion. We don't put a needle to diagnose or anything. And it is for younger people and easily accessible. Most of you would have got an ultrasound for pregnancy or for a pain abdomen. So it's almost there everywhere. It's easily accessible. And we further use it to characterize the lump. Like we can further make out whether there's fluid inside the lesion, how it is, whether there is vessels inside. We can further characterize with ultrasound. So just an example that we use a different probe for imaging the breast. The probe which is there on the right hand side with 7.5 megahertz. That is, we use a very high frequency sound waves to image the breast. Unlike for the normal ultrasound for abdomen, we use a less frequency probe. So it is a high resolution imaging done for breast. This is how we scan the breast tissue in a clockwise direction, and the entire breast will be scanned, even the underarms, so that because that is where the lesions metastasize or drain. That's the reason we also scan the underarms, and both the breast will be imaged. It's just an example of how an ultrasound image looks. You can see a small lesion which is completely black on the left side, and on the right side you can see it is a little grayish. So we can tell whether it is fluid inside the lesion, whether there is solid contents inside the lesion. So this gives us additional information. So combining with the mammogram, we do ultrasound also. For younger people, we just do the ultrasound. And coming to breast MRI, this is done only for very high risk patients. As Dr. Hafiz told, very high risk means those with a first degree family history of breast cancers, and those who have these genetic mutations in the families, or those who themselves have these genetic mutations and are at a high risk. For those people, we do this MRI breast. How is it done? We use different coils. This is how a patient is positioned. They lie down on their stomach, and the breast is placed in these coils, and the machine gets all the images from both the breast. This gives even more additional information added to the mammography images also. I'll just show you a brief data like how we are doing in our center. So this was the screening in 2018, the screening program done at Hilal Manama Center. So most of the patients were younger. They were around 20 to 39 years. 69% of the patients whom we screened during the month of October for breast cancer awareness, during the breast cancer awareness program, were younger population. And most of these patients had some or the other disease, but most of them were benign. It not necessarily it should be malignant. Even the benign lesions are very common in breast. And you can see that among all the lesions which we saw, 11% were suspicious. Means they needed additional imaging with biopsy, and they were at high risk of developing tumors, malignant tumors. And the next year in 2019 also, we saw a similar number of patients with 7% of them have showing suspicious features. So it need not, it's not to scare that all the lesions are tumors or malignant. Basically, the majority of the tumors are benign. Means it may be a small cyst or a small fibroadenoma. These are the benign, most commonly seen benign things. But we did see almost 7 to 10% of suspicious tumors in the past 2 years. Just a word about male breast cancers. So you must be surprised that the breast cancers are also seen in male population, but these are very, very rare. These are exceptionally rare. Just less than 0.25% of all the male cancers contribute to male breast cancers. And it can be diagnosed with ultrasound and mammogram also. We can do a mammogram for a male breast also. These are very aggressive tumors, which are most commonly seen in a very elderly age group, more than 60 years of age. but the prognosis is very, very poor if it is in a male breast. So that's about the screening program and the what we have done and how it is done. So the take home message for today is we have to act before it's too late. So our agenda is to detect those tumors which are at stage 1. Stage 1 means these are very small tumors, less than 2 centimeters, 2 to 5 centimeters, so that only a part of the breast will be removed, and the survival rate is very high, almost 95% for a 5-year survival rate. And early detection saves life. So as far as early as it has to be detected from the age of 40 years. We can give an option of mammogram from the age of 40 years. Between 40 to 45 years, we give an option for the patient that they can get it screened. But after 45 to 55 years, a regular mammogram is a must. Every year, annual mammogram is a must. And between 55 years to 69 years, it can be done on alternate years. Like once in 2 years, they can do a mammogram. And if necessary, after seeing the mammogram, we have to additionally do further imaging with ultrasound, or some people may require MRI breast to characterize further. So that's it about the screening and the awareness about breast cancer. So back to Madonna.
Thank you, Dr. Divya. Very, very informative. I have a couple of questions for Dr. Divya, and then we can go back to Dr. Hafiz. Um, since you mentioned that that some women would feel cysts, right?
Yes.
Would
Yes.
that lead to breast cancer as well? Should they
No,
be
no.
worried?
Okay. See, the cysts are formed in the breast because breast is basically a glandular tissue. It has a lot of glands which secretes milk. So the cysts are formed because of these glands. They get enlarged and they form cysts. And these are most commonly seen in women. And these are because of some hormonal changes in the body. But these cysts are benign things. They are not malignant.
Okay.
99.9% of these
So,
cysts are benign. But some cysts, they start increasing in size. Only then we just they just aspirate and remove the cyst. But these are not malignant. They just treat it because it will cause some pain in the breast. They remove it because not because it's malignant, just because it causes some symptoms. But most of this is 99.9% of the cysts are benign. It's nothing to worry. They just need a regular follow-up just to see the size. That's all.
okay, great. And also that now that we probably know or uh, have a couple of patients who you come across who have breast implants, right? Would a mammogram be okay, or how would you treat if they have a breast cancer or something when they have breast implants? How would you treat that?
See, we do a mammogram for breast implants also. The patients with the breast implants, we do a mammogram, and also additionally we do an MRI for the breast. Basically, for implants, we see how the implant is, whether it's in position, if there is leakage of the fluid in the implant. So implants are basically filled with fluid. So we see how it is. Mammogram with MRI will be the best option for a patient with breast implant. And if the patient has history of surgery for breast cancer, then MRI breast would be the best option because it gives much detail and it's more sensitive.
Okay. All right, Dr. Divya, thank you so much for giving us an amazing insight about breast cancer awareness. Now, I just request you to stop your screen sharing. Um, I believe we lost Dr. Hafiz a while ago. So welcome back, Dr. Hafiz. We have a couple of questions that we would like to ask you. What would be, how would we detect like the first stage of breast cancer, as both of y'all had mentioned? And how would we know what would be like the initial symptoms of breast cancer, and when would y'all recommend to visit, like the initial stages of symptoms of breast cancer?
As I have mentioned earlier, the either there can be patients can be asymptomatic. That means they don't have any symptoms at all. That will be diagnosed only. That will be detected only during a screening program, either by mammography or an MRI. Now coming to early detection. Detection means early diagnosis. Means the patient has a lump. If she has a small lump, then if the patient feels like if she has a small lump, she has to visit a doctor. So once we see the doctor, once we see the patient, what we do is we will examine the breast to assess the extent of the lump, and then we will see if there is any lumps in the axilla as well. If that is there, that means there is a cancer in the breast which has spread to the axilla. So the stage has increased. Now, once we do that, once we examine the patient, what we do is we will send the patient for imaging. Imaging will be for the breast. What we do is basic imaging will be an ultrasound as well as a mammogram. If there is any suspicious cases, in rare cases, we will ask for an MRI also. It varies from patient to patient. Once we do that, then we need to have a tissue diagnosis. Tissue diagnosis means we need to get a sample from the lump and we will send it for testing to be tested under microscope. So that there are two options. Usually an FNAC, fine needle aspiration cytology. That means we'll put a needle and we will send it for testing. If we see cancer cells, then we will initiate the treatment accordingly. Or the second and a better option will be true cut biopsy. That is, a bigger bore needle will be inserted into the lump. If it's a big lump, it can be inserted directly, or if it's a small lump, it can be inserted under ultrasound guidance. So we do that and send the specimen for again send the specimen for testing. The advantage of a core biopsy is I mentioned earlier there are something called hormones. The hormonal status of the hormone receptor status also can be assessed with the core biopsy, which is not possible with an FNAC. So it helps to decide the treatment. If we want to give a chemotherapy before surgery, or we want to go for surgery first, the decisions can be made based on only if we have an ERPR status. Because if we want to give a neoadjuvant chemotherapy, means the chemotherapy that is being given before surgery, we need to have an ERPR status, because once we give, depending on that, if the ERPR status is positive, that is estrogen receptor status or progesterone receptor status, if it's positive, then there are certain drugs which can be used after the surgery, which can be used, which will improve the survival rate. The problem with using a neoadjuvant chemotherapy not before assessing the ERPR status is that if you give a chemotherapy and the uh, lump just disappears, then there is no way we can assess the ERPR status. So it's always better if you are planning for a neoadjuvant chemotherapy. It's always need to get a core biopsy first, get the diagnosis as well as the ERPR status, and then start on treatment. So basically, once you have a lump, you go to the doctor. The doctor will examine you, then will send you for an ultrasound or a mammogram. And then once that is done, we will do either an FNAC or a core biopsy. In some cases, a core biopsy or FNAC might not be possible, especially if it's in USG detected or mammogram detected lesions. The patient might not have any symptoms at all. There is no lump to be palpated by the doctor as well, but it's seen in the ultrasound or mammography. So what we do is the sonologist will insert under ultrasound or mammography guidance, insert a guide wire into the lesion, and then we will take the patient to the theater and remove the rim of tissue around that guide wire and send it for testing, and we will see if there is any cancer or not, and depending on the report then we will decide. So basically clinical examination, this triple diagnosis, as I mentioned earlier, triple diagnosis: clinical examination, second is imaging, third is a tissue diagnosis either by an FNAC or true cut biopsy, or in some cases excision biopsy. We'll remove the lump and
Great, perfect. I think we have one of our attendees who has raised the hand, Maha Devaya. I believe you have a question. Mahadevaya, are you able to hear us? You can ask us your question. You can ask your question over here. All right. Maybe when we get back, we can ask Mahadevaya to ask the question. Just another last question before we end the session. Dr. Divya and Dr. Hafiz, any tips, foods that we can avoid or take, or any healthy lifestyle that we should follow to avoid all this, the breast cancer?
basically see, if you are obese, the chance of uh, your cancer, any cancer, increases. If you are overweight, if you are obese, the chance of cancer increases. If you are normal weight person, when you compare two persons, who is one is no overweight, one who has normal weight, the chance of cancer is more with the overweight person. Again, so and some studies have shown that certain diets will reduce the risk of breast cancer, like Mediterranean diet, because the it contains more of plant and plant products. So basically, it will reduce the risk of breast cancer. So if you, but the one thing that we need to understand is that eating meat will not produce breast cancer, or eating only plants doesn't mean that that person will not get a breast cancer. But if you are overweight, if you are obese, then the chance of breast cancer is more when you compare to a person with a normal weight. That's it. And this causative element is yet to be established, but still um, there are certain studies which have shown that these Mediterranean diets and plant-based diets, they will the chance of breast cancer is much less in this population.
Dr. Divya, anything you would like to add to Dr. Hafiz?
Yeah, as Dr. Hafiz told, it's basically the obesity which increases the risk for the breast cancer.
Is it unmuted?
Yes, Dr. Divya?
Yeah. So basically, it's the obesity which causes increased risk for the breast cancer.
Dr. Divya, we can hear you.
Yeah. Hello? Yeah. Hello? There is some problem with it.
Maybe if Dr. Hafiz can just turn off the main mic, the main sound. Yes, Dr. Divya, you may
Yeah.
go
Am I
ahead.
audible now?
Yes, you're audible. You may go ahead.
So
Anything you'd like to
basically,
add?
the most important thing is the obesity, which leads to the breast cancer. There's some problem with the audio.
Okay.
Yeah, so what I want to tell you is in the laptop audio. I'm sorry for the disturbance.
All right. Yes.
Hello? Yes.
Yes, you can go ahead.
Sorry for that.
Yes, Dr. Divya.
So basically, the obesity leads it's a high risk factor for those who are obese to get a breast cancer. So lifestyle, diet, all these matter. And those who have a family history of breast cancer should be more aware of these programs, and they should not neglect. As see, for instance, if the mother was detected breast cancer at the age of 15, the screening for the daughter starts 10 years earlier. Means at the age of 40, only intensive screening should be started for the children, the daughter. So this is one important thing for those who have a family history of breast cancers.
Okay. So thank you so much once again, Dr. Divya and Dr. Hafiz, for joining us and participating in this wonderful breast cancer awareness session. Uh, we have received a lot of informative tips and precautions and methods to avoid breast cancer and the procedure of the breast cancer as well. So we would like to thank our attendees as well for taking out time of their busy schedule to be a part of this awareness session as well. Ms. Gopika as well, thank you so much for all the support in this, supporting us to go ahead with this. And
Thank you.
would you like, yes, um, we would wish you all to stay safe and always examine yourself and be aware, and always, if any doubts or anything, always go and visit a doctor. So thank you once again. Have a lovely Sunday, all of you. Have a blessed Sunday. Stay safe and always try to stay fit and try to stay active. Thank you so much.
Thank you very much. Thank you. Thank you, Hilal.
Thank you so much.
Bye.